Welcome, everybody. My name is Aiden Hobbs. I'm an advocacy coordinator for P.L.A.N, People Living with Aphasia Network. I just want to say a big thank you for joining us today for this webinar. We appreciate it.
Hi, this is Gary Delgado.
Gary started this organization, and we are really trying to make a difference in the healthcare space. We're going to start with a screening of our video. It's about 3 minutes long. And then we have Holden joining us from Fight Health Insurance, who will be talking about the website that they started to make it easier to do insurance appeals when you've had claim denials. As the moderator, I will be checking the chat throughout and we'll try to address as many questions as possible towards the end. If you need to ask a question throughout, you can use the little react button down at the bottom or type it in the chat. Are worth the fight. P.L.A.N is taking a stand to inform and change the healthcare system. We are people who have aphasia and stroke survivors fighting for healthcare justice and organizing together for a better future.
I had aphasia 5.5 years. After the stroke, I couldn't talk for 6 months.
Speech therapy and occupational therapy lasted like 8 weeks. It's a lifetime thing, and it lasted 8 weeks. The hardest thing was to fact that for long-term insurance, which you would think would pay out, we had to pay him back $32,000.
Congress has cut $1 trillion from Medicaid for the next 10 years. This means 79 million Americans will lose coverage. The use of AI speeds up claim denials to save insurance companies money. Patients are treated like dollar signs, not people. AI slows down a patient's access to care and hurts recovery, say 90% of doctors. But we can reclaim our power through action. People in 36 states are demanding clearer and pro-patient changes to how AI is used in healthcare. Nebraska banned AI as the sole reason for denials, and the denial must also come from an appropriate doctor. If we can do this in Nebraska, we can do this anywhere. Tysonia from Seattle challenged the system after her stroke to get the care, support, and money she deserved.
I applied for disability through Social Security maybe 3 months after I had my stroke, and it was like maybe another 9 months to a year to get that court date. First biggest piece of advice is advocate for yourself, but have someone else with you, because it was very difficult for the hoops and the forms, and it takes a long time to process these things. I was able to do some of it, but I had to have someone there to help me. So you definitely need someone there advocating with you.
P.L.A.N organizes people who have had a stroke and or have aphasia in their communities. As a grassroots organization, we work in 5 key areas. 1. Legal rights for stroke and or aphasia. 2. Technology for all of us. 3. Research and unaddressed issues. 4. Peer support models. 5. Alternative treatments. We are determined to change the current system. We hope you will join the fight to disrupt the misuse of AI in healthcare insurance. My name is Aiden Hobbs, an advocacy navigator for P.L.A.N, People Living with Aphasia Network. Holden is a Canadian-born trans woman here in the States who has been in tech for over 10 years. And she started fighthealthinsurance.com after a car accident forced her to experience the joys of an American healthcare system as a Canadian. She enjoys her dog, Professor Timbits, and also had to fight for pet care insurance. Her dog had to have a root canal and they didn't want to cover anesthesia. Holden, I'd like to turn the floor over to you.
Thank you. Thank you so much for that introduction. And let me bring up the slides. Share screen. I come from Canada. I've seen a different system, and I know we can do better. And I know there's so many wonderful people trying to make the system better here. I believe that we can. I think it's really important to not give up hope, because it can certainly feel like doing that sometimes. At least for me, there's just so much happening. It can be really easy to throw in the towel. There's times when we need to take a step back, but it's important to remember that it can be better, and we can be part of making it better, all of us together. And so I'm going to talk about Fight Health Insurance. It's a tool that we've built. It uses AI to help people appeal health insurance denials, but there are so many other things as well that we can do and should be doing. This is one of the many tools in the toolbox that I think will be helpful. I certainly wish I had it back when I was in my car crash in 2019. I think the important thing that the insurance companies don't always make it clear is that you actually can fight back, and you have the right in almost all circumstances to appeal their decisions. This goes beyond just the first time, right? So you'll appeal a decision fairly frequently that will be to an internal sort of appeal, and then they may say no again, but you often have the right of appealing to an external reviewer. It's important to stick with it, and it can be really frustrating, very slow. It should not be, but they sort of count on us giving up. And so it's important to not give up. I want to be clear. I think Fight Health Insurance is a great tool, but there are similar tools from other people as well. I'm obviously very biased because I've worked on this for quite some time. If you're like, listen, it's cool, but it's not quite what I want, go out and explore. There are other people and other tools that are doing similar things in different ways. At its core, Fight Health Insurance is, I think, this really cool website. It's AI powered. It helps generate appeals. And the first step is figuring out either, do I want to appeal this denial, or what is going on? I got this letter from my insurance company. What does this mean? Or maybe you have like questions about your insurance, and we have a chat agent that can help you figure out what questions to ask your insurance company. They don't always help provide the information that you might need without you prompting them for it. So I think most people come here and you'll end up clicking on generate appeal to get started. But if you're not like ready to appeal a denial and you're just like, I'm trying to figure out what's going on, we also have this explain my denial option here as well. I got this letter from my insurance company. I don't know what this means. Please translate this to something that, some of the things that I think are cool. It's free. It's very much pay what you want. There are other ones that cost money. They can be good too. It's a matter of personal preference here. The other thing that we do, and this is, we've focused a lot on privacy. So as much as possible, we try and keep the information on your phone or on your computer. When you're going through this process of making an appeal, we'll see it. We help make sure that only the essential bits of information end up going on to the servers, and the parts that don't have to be are stored on your phone or on your computer. This is what the website would look like if you go to fighthealthinsurance.com. But if you've got a phone or a tablet, it might end up looking more like this. It's a very similar screen. Just might not look exactly like you're going to see in other screenshots, but it's going to be like this. You might end up with this vertical view on a phone. The first thing is, and I know I was just saying how we do all this stuff for your privacy, and this is intuitive because we ask for your name and your email and your street address, but these things are actually stored on your computer instead of on our server. We ask for them because these will be in your denial, and what we do is when you provide these here, we take them out of the denial before they get sent into the computer system on the back end. By collecting this information here, it actually lets it stay on your computer instead of going onto our computers. And honestly, I'm one of those people who cares a lot about privacy, and I think it's really important. So I just want to be like super clear. And it's not perfect. We're doing our best, but I'm sure there will be things that are a little imperfect. So you fill out this information. I've got my name here. Now, most of the time, we get a letter in the mail. Sometimes you get an electronic explanation of benefits or something on the website. In either case, you would press choose files, and that's where you attach your denial or your explanation of benefits. You can take pictures of it if you got it as a letter in the mail, or if you got like a PDF from your insurance company, you can put it there. This is where we upload the denial. And then after that, there's sort of these standard policies that everyone should read in practice. Not everyone reads all of the policies that they agree to on the internet, and I'm certainly not going to tell you that you need to do differently in this case. But I think it's nice. We've got this remove PII button that you should press, and then you should double check to make sure that you're comfortable with the information that is remaining being transmitted to our servers. We also have this terms of service that this is just for health insurance appeals, right? We are not doctors. We can't offer treatment. We can help you appeal insurance denials, and we're really good at that. But please don't ask our computers for medical advice. I would not trust them for medical advice. We've got some sort of optional additional checkbox here. So you don't have to agree to these. Of course, if you do, I love it. It's really nice for us to be able to follow up with the people that use the service and ask them how it went. Another point here is if you're on a shared computer, you will probably want to uncheck this final box here. And that's just because by checking this box, we make it a little bit easier if, as you're going through, realize, oh, I wanted to change something on the previous page. It makes it easier to go back and make that change. But if you're sharing a computer with someone and you don't necessarily want to have your information stored everywhere on that computer, you can uncheck that box to increase your privacy a little bit. In my experience, when I'm going through this process, I frequently realize that I forgot something and I want to go back and make a change. I recommend leaving it on. Once you're okay with all of that, you press submit, and it'll take you forward to this optional health history page. This is a page where if you have a document describing your health history, you can copy and paste that in here. For example, if I'm dealing with denials related to things like gender stuff, I'll write in a little bit about like I'm trans, this is when I transition, stuff like that. That just helps the computer do a better job of figuring out what's going on. Because in theory, maybe that information is present in the denial, but oftentimes you see denials coming because they don't have enough information. And so this can be a place where you can provide that information to make sure that it ends up in the appeal. Another thing that we have here is this plan document page. This is the page that you get to next. It's also optional. Most people don't have their plan documents. In my experience, insurance companies make it really hard to get your plan documents. But if you have them, it's fantastic. If you provide them, again, the computer can do a better job making an appeal. Then we do sort of analysis of the denial. This part happens automatically in the background. And so it goes through it and it tries to look like, what is the reason the insurance company said no? What excuse did they essentially come up with trying to not pay? What procedure or diagnosis codes were in there? This can take a little while. After it's done, you go ahead and you review the information that is figured out. This is the page where the computer's like, I read everything you told me, and this is what I understood to be true. And that's not always 100% correct, right? Computers make mistakes. A big part of the problem with insurance companies is they don't really have anyone bothering to review the computer's decision a lot of the time, or at least I don't believe they have anyone reviewing the computer's decision. Here you can review the information that we've extracted from the denial. This is the place where you would say maybe they wanted you to do step therapy, or maybe they said this isn't medically necessary, or some other questionable thing here. If you've got a claim that's in the past, it's really important to provide the date of service. If you've got a prior authorization denial, prior authorization is when the insurance company makes you get permission from them first, which is just completely screwed up, but it's a very American thing where they're like, we're definitely not practicing medicine, but come talk to us before we let you do what your doctor said you should do. That's a field that you might not always be filling out. You might not know what the date of service is. And so it's okay if you don't know some of these fields. You can just leave them blank and the computer will do its best. And then we get to this generating the appeal page. Essentially, while you're waiting here and you're kind of frustrated, or at least I am whenever I get a denial, and I get to at least look at a picture of my dog. He's really cute. He hates insurance companies almost as much as I do. You can just hang out there and wait while it's doing its thing. Afterwards, it'll generate a few different appeals. Here we've got a sample appeal, which is generated. Here we've got appeal for denial for preoperative preparation. We say, yeah, this is the appeal that looks good to me. It's got these placeholders in it because it doesn't know your name. Once you've chosen it, it'll go forward to the next screen. And I'm going to go ahead and I'm actually going to bring this over here. And we'll hope that this works. And so this will bring you forward to this screen. And this will have your personal information here again. And you'll say, I want to put my personal information back into my appeal because the insurance company needs to know who you are, but we don't. It'll put it in, and you see here, replaced first name, last name with my first name, last name. And then here I've got a fake fax number of 123. Optionally, you can have us fax it, or you can print it off. Very few insurance companies will let you submit appeals electronically. If you have one that does, you can do that too, and you can actually go ahead and copy paste it into Google Docs or your favorite editor and make any changes that you want to make. And you can go ahead and fax it. We see $0. Huzzah, great success. But of course, anyone wants to give us money, we've never said no. I did want to have a little bit about why this is what I worked on. A lot of my experience also comes from having PT and OT denied for different reasons, but my insurance company was very much like, hey, why haven't you relearned how to walk? It's been 5 visits. And I was like, it takes more than 5 visits to relearn how to walk after a car crash. This is really hard, right? I had great doctors, great physical therapists, and occupational therapists. My insurance company really wanted to send me somewhere that was very affordable for them to continue my rehab. I had a fantastic OT, but they were like, you should probably, I'm not saying you shouldn't go, but you should call them first and talk to them and make up your mind, because you don't have to accept what the insurance company is saying. And I was like, wait, really? And they're like, yeah, no, you should call them. And they did. I was like, oh, wow, this place sounds terrible. And it is currently under active investigation by the Department of Managed Care. I don't want to go there. Let's not go there. And thankfully, my wife argued a lot with the insurance company and managed to get discharged to a much better place. It took quite some time, and there were a lot of scary bills, right? Like we got them and we argued with the insurance company afterwards. We did pay a few of the scary bills because they weren't all completely winnable. You're not going to win all of them, unfortunately, but you can win a lot of them. That's why this is a problem that I think so much about. There's my personal experience, and then also my friends have also had a lot of challenges just dealing with American healthcare and getting told no a lot, just so much. And then the other thing that I wanted to wrap up talking about health insurance is that fundamentally what we have is a social problem. And trying to fix social problems with computers, this is not the be all and end all, right? Like the solution to AI isn't just more AI. It's also the advocacy work that was talked about in the wonderful intro video, right? Like part of it is, yes, we can stop some of the worst of it by fighting back individually, but also by working together, we can change the rules. We don't have to accept the rules. Maybe we have to accept them for what we fight for today, but for what we fight for next year or the year after that, we can try and make things better. And ideally, and this is not a thing that people normally say about things that they've built, but I really look forward to the day that people don't need fight health insurance. I believe that we can get there. I think in the intervening several years, because it's going to take us a long time to get there, fight health insurance is still going to be really useful because it's really hard to write these appeals. It takes a lot of work, and we can make it easier. We can make it so that it's not as easy for the insurance companies to just say no to everything, because we can appeal everything.
Holden, thank you so much for that. I'm going to turn the floor over.
I just wanted a couple questions. It's great that you put this together, by the way. This is awesome. Nice job. How long does it take for people that want to do this?
That's a great question. So I would say the length of time really depends on how complex the denial is. So for things that are like super straightforward, where the insurance company is just completely wrong, they deny preventative care or things like that, where there are laws against this, those ones can be like 10 minutes. The ones where they're saying, hey, why aren't you better? It's been 10 visits to physical therapy. Those ones can unfortunately take longer because you often have to go back through your own notes and write it all down. These are the dates I went to physical therapy, and this is what I improved, and this is what I still need to improve. And so those ones can take maybe half an hour or even an hour, and that can be a lot. And I think it's also okay to take breaks in this process, right? It's okay, I've got this really big, scary denial that I need to appeal. It can feel overwhelming. Today, what I'm going to do is I'm going to collect my notes from my doctor. And then tomorrow, what I'm going to do is I'm going to write down all my visit dates. And then if you do a little bit each day, then you can eventually put it all together. Or depending on the day, I know some days I drink a lot of coffee and I'm just like, you know what? I am going to do this, and I'm going to do this today. An insurance company is not going to know what hit them. Then you just do it in half an hour and you drink a lot of coffee.
I noticed that you guys actually are using AI. Talk about a little bit about that, and how do you feel about it?
Okay, so to be clear, both myself and my co-founder Melanie, we both are like nerds at heart. And I do want to say that as a nerd, I'm sorry for a lot of the things that we've done, especially recently. It hasn't been our best work yet. To be fair, I don't work for most of those people, but we've done a whole bunch of work to try and make our AI relatively environmentally friendly, which I think is really cool. There's this process called fine tuning. And so that's a process where you take like a general purpose AI and you give it lots of examples of a specific task. We've got an AI which has a lot of examples, and it's largely based on California independent medical review data, as well as Washington State. I think we got a little bit of Texas in there too, but we give it lots of examples about a specific task that we want it to be really, really good at. And so when you do that, you can actually make it so that not only is the AI better at this specific task, it also uses less resources. Generating an appeal with our system probably uses about as much power as playing a video game for 10 to 15 minutes on a new computer. And that's not zero, but I'm pretty okay with that. I think that's a fair trade-off for getting people access to care. I think that the AI systems should not be used by the insurance companies, full stop. That's probably not going to happen soon. That's going to take a lot of work, and that might not be achievable. We might be able to get to the point where what happens is the insurance companies use AIs and then it has to be reviewed by a human. And that's, I think, something that's very doable. In my mind, this is like trying to balance the scale because the insurance company has so much power and so much money to throw at not paying the money that they should. And this is a way of giving us the power to fight back.
Excellent. Thank you for explaining that in a way that makes sense in terms of the AI being more environmentally friendly, but not like zero. I do want to open the floor. There was a question in the chat. I want to address that just for everybody. We are recording this and it will go out as an edited recording and probably be up on our YouTube page, P.L.A.N. People Living with Aphasia Network. It won't be immediately. We'll do some tweaking and editing magic before we actually put it out and send it out to people. Lisa has a question, and then if anybody else has a question, you can also raise your hand and we'll get to you in order. Go for it, Lisa.
Hi, Holden. Thank you so much for this presentation and for building this amazing tool for people to use. My first question is, what has been the experience of people with cognitive deficits in using the platform? Not just aphasia, but just other thought processing challenges, because I'm thinking there's some people that could probably navigate it on their own and some people who might need help. Thank you.
Thank you, Lisa. It's a great question. I would say, in general, when you can, regardless of if you're using a tool like this or not, and regardless of if you have cognitive challenges or not, having someone with you to help navigate the insurance process when possible is an amazing thing, right? When I got hit by the car, having people that I cared for and cared for me helped me navigate the insurance process, I think was a big part of me being able to achieve success. Even before then, having someone help navigate is always useful. They don't have to be like especially good. I think one of the things that I struggle with is where, you have a thing, you need to do it, but doing it is incredibly hard. So you will just do other things instead. Even just having someone else next to you can be helpful for some people, even if they're not like actively helping. I will say, because of how we have the website structured, where we don't store a lot of information about people, we only get information from people who either check the box that says, this is okay, please follow up with me, and then we send them an email and they send us an email back. We have some reports of people with like cognitive differences successfully using the website, but it's not a huge sample set because we default to such a high privacy level compared to, for example, like OpenAI or Google, who might take a different approach to user analytics. So I think, though, regardless of if you're using Fred Health Insurance or not, and regardless if you have cognitive challenges, if there is someone who is available to help you, even if they're not an expert, regardless of if you use this tool or not, just having a second person there can be an amazing support. And I'd encourage people to reach out to their friends and ask them for that if they can. Not everyone is so fortunate to have people in their lives who can help. That's unfortunate.
Is this only for healthcare denials? Can it be used for other sorts of denials like SSDI, etc.? Thank you.
Great question. And so the answer is we've only really tested it on healthcare denials. However, we actually have talked with people who reached out to us and was like, hey, we have this denial. I don't know what to do. Can I use it? Well, we don't know if it will work or not for your case, but then some of them did use it successfully from talking with them. Things like dental, which is healthcare like pet health insurance claims as well. That's something where I've used it personally. I would say you could, but as always, you should always be careful with any AI system. I would say if you're using it for anything other than healthcare, an extra level of carefulness would be what I would recommend. It's not like you can't, but, and then this is the trade-off because it's fine-tuned on these healthcare cases. But the other thing is pet insurance, dental claims, and SSDI things are different, but they're also not 100% different. So it does still manage to have some success there, which we were pleasantly surprised about, but also there's no guarantee that it would continue to. It would be very important to do lots of manual checking. But great question. I really appreciate it.
For Holden, we've got about another 10 minutes, 15 minutes. I do have some things I need to do at the end, but we'd love to hear feedback from other participants.
One of the things that we looked at initially around the stuff about AI, we've noticed that people of color and Latino folks are having problems in terms of being able to address a lot of these problems. I'm curious about whether or not how this has actually worked for people of color.
That's a great question. I would say, again, and this is the trade-off of the privacy decisions that we made, is we don't know for sure about a lot of people because we don't store as much information as others might. We know that there have been, people of color who have used it successfully, but we don't know really the demographic breakdowns of our users super well. We've got people who have reached back out to us to tell us how it went, and then went beyond that and told us a little bit about themselves as well. We have some very basic demographic information that shows it does skew more towards people who have had secondary and post-secondary education, but we don't know a lot of other things about the population in terms of users. One of the things that we do want to do, but I want to be clear, we don't do it today, is better support for Spanish language, because really any other language but Spanish is the top of mind one living in San Francisco. As you see, the website is in English, but the problem of being a very small team, it's got 2 people. So how many things can we do? I think the next big thing that we would want to do after updating the AI model is making an updated AI model with some Spanish language examples in it as well. And then I want to try and play with it before we promote it to Spanish speaking communities and build that confidence in-house that it's going to work well. Because today, the majority of the training data is in English. So it's probably a big area where we could improve next, I think, in terms of reaching people from a wider background of communities. Fantastic questions, everyone. Thank you so much for your time. I really appreciate it.
If there's anything else people want to talk about, please.
Colleen?
You mentioned doing it together. Now, how do you go about that? You're in San Francisco, but how do you do this together? We can march and we can write letters, but that's not, as you said earlier, that's not all of it.
I think there are many different things, right? I think marching and writing letters is a big part of it. It's not going to change tomorrow, but that can be part of what changes next year, right? Or the year after. This is in many ways like the first aid solution, right? There is a problem today. The problem is people are not getting access to care. So we can try and make it easier to appeal more denials. And that's what we can do immediately today to help people today. But then also, I think we should not stop writing the letters, contacting our Congress people. I recently got the right to vote in this country, which as an immigrant, it's very, very excited, still also a little disappointed. But voting, doing all of these other things to try and affect civic change are equally, if not more important, because the long-term solution can't just be having 2 robots fight it out, right? That's an okay short-term solution, but the long-term solution is advocating for legislation. I think we can do that at the state level. We don't have to only hope for the federal level, right? The federal regulators are currently otherwise engaged, but the state can have a large impact. Now, certainly, there are some health plans that are exclusively regulated by the federal government. For example, the health plan that I'm on is under federal regulation. So state regulation isn't going to do a lot to help my specific health plan, but it can have a huge impact on other health plans that are regulated by the state. I'm thinking about the things that I can try and accomplish at a state and local level, because that's the level that I see us as having engaged representatives who can make a difference for us.
That concludes our webinar for today. If you have any questions or comments, you can also email me directly at Aiden, AIDEN, at aphasiaplan.org. It was great to have all of you here. We want as many people as possible to know about the possibility of fighting back against claim denials. Only 1% of people actually fight back, and we need to change that number. And if it floods the insurance companies and makes them pay attention, then that is doing the grassroots work to make a more systemic long-term change. Thank you so much for joining us. Again, we are P.L.A.N, People Living with Aphasia Network. We appreciate you all joining us today.